Okay, I'm starting recording now. So let me just get ready. Get the chat open. Manage participants. Okay, yeah, very good. So, as I say, first things first, can you see the text? Can you see the letter on the screen? I'm doing a screen share. Somebody give me a yes if you can see it. Can you see the letter on the screen? Okay, very good. Now, I don't want people writing in saying, how come you didn't assess me? How come you didn't? Because I just pick whatever letters, the first letters that come into hand. It's nothing personal. I just pick whatever letters are at hand. I've had people send them to my email, on Telegram, Easy Class, and on Patreon too. So whatever I've got time for, and I say I only have half an hour now, but I thought I could squeeze in a bit of assessment this morning. As I say, I'll probably have another session tomorrow. It's going to be at more than likely 9 a.m. GMT. Okay, I'll schedule it a bit later and post a link. Now, most people, I think, who were in Easy Class are for the January exam. So I'm probably going to start a new group for the 2 exam dates in February. I believe one is February the 2nd or something, and the other is February the 23rd. So we've got 2 exam dates in February. Is that correct? I think so, according to what Joseph sent to me. He says there's 2 exam days. So we'll be working up a plan for that. What I would advise if you're taking the exam in February is, unlike some people in January, don't wait till the last week and then start sending in letters. Oh, please assess my letter. Oh. Because one, I won't, or I might not have time. And 2, you should have done this well in advance. Don't wait till the last 2 or 3 days and then start complaining that nobody's assessed you, because that's not our fault, right? Do it in advance. Don't wait till the last week. Get somebody to have a look. Identify your mistakes, because even if I tell you what your mistakes are, you still have to work on correcting them. If I say to you, your grammar is crap, you need to work on articles, present perfect, etc., that knowledge alone will not help. You've got to work on it. Watch some videos, do some study, do some practice. So even though your mistakes have been identified, you've still got to do something to stop making them again in future. Anyway, so I've got 3 letters here. That's all I've got time for. As I say, another session tomorrow. We'll see how it goes for the rest of the week, because we've got like 3 weeks before the next. Was it 3 weeks before the next exam? I think what OET are trying to do now, they're trying to do it every 3 weeks. So we've got 3 weeks till the next one, then another 3 weeks. So there's no urgency for me to have sessions every single day. I'll try and squeeze 1 or 2 in a week so people can try and keep on top of things. So, Rafida, if I've said that correctly, I don't know, maybe I pronounced it right, maybe not. She sent me this letter to my email, so we'll have a look. So this is, from the first thing, it's Mrs. Khaze, not Mrs. Khaze, isn't it Khaze? Khaze, yeah. So she spelled that wrong anyway. But we'll get on with this and we'll see. So I'll post the saved letters. So I've got a 3 and I've got about half an hour, so I can spend a bit of time on each. If you do need personal corrections in detail with a proper report, you can try my premium service. We'll be posting about that a bit later on. Usually you get receipt within 48 hours. If you want express in 24 next day, that's going to cost you a little bit more, but usually 48 hours. Anyway, that aside, I'm writing to refer Mrs. Khaze or Khaze or Khaze. Now, I've got the case notes for this one here. What do we want to do? Oh, did she include all the case notes? Probably not. She sent me something. I can remember from the other day. So you're referring her to a surgeon. You want a complete assessment and possible reconstructive surgery, if I remember. Okay, and the patient's sister was operated on by the same guy, and that's why she wants him. So we've got to make this clear. You know, the reason you're writing to Dr. Omer is because he's got a history with the sister. So that's an important, you know, that's the main reason why you're writing to him and not to someone else, right? Anyway, to refer Mrs. Khaze for what? Who has diagnosed? Wouldn't it has been? With invasive ductal carcinoma of the left breast, she required. Why is it in the past tense? Shouldn't it be she requires? Surgical intervention. Well, okay, we don't really need an article with a possibility of a reconstructive surgery. Your provisional care is requested. What does that mean? Provisional means in theory, not in practice. It means you agree to do something unless circumstances change. So you wouldn't say that in any case. So refer, well, yes, but again, I've said this on several occasions. As a matter of fact, I was correcting a letter a few moments ago before I came online, and it was something about immediate transfer. So it was, so if you're using the same expressions, refer, okay, but you know, use the specific verbs in the task. Is it a discharge? Is it a transfer? Is it a request? This one here, as I remember, is a request. You want this surgeon to do something. So you can, you know, I'm writing to refer, but you have to refer for what? So why not simply use the right verb? I'm writing to request your treatment, assessment, reconstructive surgery of Mrs. Khaze, blah, blah, blah. Okay, that's better in terms of task achievement. So let's see, we've got make it passive there, passive verb form, make that present simple, third person S for that verb. Possibility, your provisional care as opposed to what? I'm not sure. Okay. Okay. So the first thing, the very first thing, so imagine I'm a surgeon. The very first thing that I need to know about this patient is that she has a regular period. Is that the first thing that I need? What do you think? Anybody make any comments? Is that the first thing that should be in this introductory paragraph? Sorry, in this paragraph. Is that the first thing? Oh, Mrs. Khaze, she's got a regular period. Oh, and by the way, she's had breast cancer. Is that what we really need first? No. So make sure you structure the information logically. Okay, if you have to include this, put it farther down. Okay. Had a past history of unprotected benign tumor in the right breast years ago. In terms of my history, a sister had suffered from breast cancer, which was treated accordingly. Yes, treated accordingly by the same guy that you are writing to. So you should mention that. Yeah. Okay, the patient had a brief checkup during a clinical examination. A hard, ill-defined lump, as one of those were detected, suggested diagnosed, or diagnosis. Shouldn't that be a noun and not a verb? Suggested diagnosis of breast cancer, carried out and reviewed in the next visit. Well, in or at, on the next visit. At a subsequent visit, patient's results have been checked. Why is it present perfect? If, at a subsequent visit, so it's a particular time in the past, so we can use the simple past. Yeah, the patient's results were checked. Have been checked by whom? I presume you checked them, so you can simply say were checked. She was rated multiple times, knowledge was verbal, echogenicity, therefore competency was offered. Offered? Offered. I don't think it's an offer. Well, okay, Mrs. Khaze, if you really want, I'll do you a biopsy. An offer. I don't know if that's the right verb that we should use. Arranged or something, but not offered. It's hardly an offer. You're not selling a used car. Make me an offer on this biopsy. No? Okay. On today's review, this breast has been confirmed. Hey, what is thence? It's either thus or hence. There's no such word as thence. Therefore might be better, or as a consequence of, or something. Okay, but that's no good. Referring to your care, physical assessment, and management. Okay, but what does that? Hang on. Kindly, the patient wish is to be operated on by Dr. Ala Omer, but that's who you're writing to. So why are you referring to him in the third person? You're writing to this guy. So why are you doing it in the third person? Okay. Kindly, I'm with you to your care for surgical assessment and management. Kindly note that the patient's right now we need the possessive, the patient's wish belonging to the patient is to be operated on by you because you're Dr. Omer. So that's not so good. I would be grateful if you could manage her condition as you think appropriate. Well, you would be grateful. Okay, that's you can say that. So we've got some obvious errors here. Some obvious errors. If they think you've misinterpreted the notes, if they think you've misinterpreted the task, you're going to be lucky to get C+. So we've got some grammar here, that introduction. So we've got I know it's been typed out, so it's possible some punctuation and spelling as a consequence of typing, but even so, spelling, punctuation should have been passive, wrong word form, adding details that we don't really need, the wrong order, not reading the task or not using it all. Yeah. Surgical intervention of what exactly? A mastectomy with a possibility, because it did say it was possible. I don't think it said it was directly a fact. It said something about it. But again, I don't have a case notes immediately to at hand. It's only one I can remember. So further surgical assessment. Yeah, mastectomy. Okay. So there's a fair number of errors in this letter. I'm sure when you find the case notes and you compare, you will see what I'm talking about. Now we've got a different one. This is Barry Jones. Now this is Elaha. She was requesting an assessment, so I thought I would. Again, I don't pick letters out. You know, there's no order to it. Usually I try and find people who haven't been assessed first, and I don't think you've had an assessment yet. I don't think so. I'm not sure, but we'll see. So this is Barry Jones. Okay, this is the guy I remember hurt his back at work. He's a forklift driver, and the case note said something about so you're making a request for an occupational assessment of his work. Yeah, that's what it is. So it's not a referral. Yeah, they want you to go to his workplace, check it out, see if he can return back to work. Yeah, okay. And to questions in the patient's workplace, was something from severe to sever means to cut off. Severe. To a question of assessment of patient's workplace, so has been suffering from severe low back strain. Well, he's not been, well, he hasn't had a low back strain at work. He did it at work, but he's not been suffering at work because he's off work, which is not quite the same thing. Yeah. Caused at work, say, or to make it less confusing, simply say lower back strain for the last 3 months. I mean, you can explain how, and which you can do here. Okay, presented with back hurt, with back pain or a hurt back or injured back, and you need an article with a back injury, I think is better. Having lifted a heavy box at work 4 days previously, okay, which thought as well, which requires flunk sitting and occasional heavy lifting. Now, I can't remember exactly, but this looks very similar, I think, to the wording in the case notes. We'll have to take a look at this. This looks pretty similar to the wording in the case notes, and we need to paraphrase. They don't like it if it looks like you've lifted words and phrasing from the notes. Okay. His x-ray was unremarkable. Well, first you've got to mention that you took an x-ray. We'll see, was mentioned in case of a back strain, also was referred to physio or to a physiotherapist. This, moreover, he received 30 days off work certification. Okay. On review, 30 days later, not only was he suffering, not only he was, watch that word order, not only was, because it's right, it's a negative inversion, right? So usually you would put subject, verb, an object, right? He was suffering, but because we've got a negative adverb at the front, right? You can take a look at this. It's called negative inversion with adverbials. Okay, so when you the usual one, he was suffering, subject, verb, object, you know, but here, because we've got not only the negative inversion at the start, the word order is inverted. Okay, so not only was he suffering from back pain, but also his physio exercises were very painful. However, he was compliant. Well, you're not compliant to, you're compliant with. And again, you can use it, but people, you know, recommendation is not to use it because it's a bit judgmental, especially if you say non-compliant, for example. Right? Accordingly, his time off work was extended. Don't forget your auxiliary verbs were extended to 30 days afterwards. A month later, although he was recovering well, but still in pain. Right. Now, we've got two conjunctions here, which we use to indicate a contrast. We don't need two because we only need one. So either, although he was recovering well, he was still in pain, or he was recovering well, but was still in pain. We can't have both, right? Can't have both because it counteracts, it contradicts, right? So either this one or this, okay? We can't have both. So, work was the end of the game for a month. Today he came, no, don't need a comma. Today he came bored and discouraged, wanting to return to work, still in pain. So again, you've got two here. You can't have two because it doesn't make sense. Although he has been recovering well, but he's still in pain. So if he's still in pain, how is he recovering well? You know, it's like, pain. That's a good recovery. So you've got to watch the logic of your sentences. Be careful there. There's in pain, we can provided having, he is having, or he has, we got breaks everybody. Appreciate now. We need a dummy subject. It. There is no it. Right? It's called a dummy subject. And the idea is to make the sentence grammatically correct. So I would appreciate what? Appreciate it. So there is no it, but we have to include it. You can have a look at it. If you Google dummy subject, that's what it is. Appreciate it if you could see this patient's workplace for assessment, or if you could assess this patient's workplace. Okay, so not too bad. You can see there's a few things there. You can have a look at this afterwards and see. So I've just got time to do this last letter and I've got to get off. Got some students coming, I've got to prepare for that. So Mr. Jones again, and Miss Islimia. Yeah. Why do you all use different spellings of your names? You know? So here it's spelled with an I on easy class. Here you spell it with an E. Rita sometimes says R-E-E-T-A, sometimes R-I-T-A. So sometimes I don't know who I'm. Well, you know, you've got to watch it because sometimes I think I'm writing to one person and it's someone else. So if you can try and have the same name across every platform, that will be good. So there's no confusion on my part. Anyway, let's have a look. We need some paragraphs. Break this up. Okay, I might do question of advice regarding workplace of Mr. Jones, where the forklift driver has been to work with back pain injury has prevented him from continuing his job. Okay, all right. So you see, right, the key words. There's no referral or management, none of the standard phrases that don't express exactly what it is you want. Here it's clear. I want you to do something. That's what you've got to do. Assessment of the virus, workplace of Mr. Jones, okay. A little bit, you could have made it maybe shorter, but it does its job. We've got patient to me before the history of backache, standard what's at work. Disc problem, a disc problem or disc prob. Now, okay, now in terms of articles, if you're talking about problems in general, we usually make it a plural. Disc symptoms in general was excluded or were excluded by X-ray. Diagnosis of sever means to cut. Severe is an adjective. Sever means to cut, amputate. Sever equals cut. Severe equals serious. So make sure that you get those right. Let's go back. Diagnosis of severe back. What? Pain, injury. Therefore, he was referred to physiotherapist. Painkillers were prescribed to him. Or now, okay, right. If you make everything a passive, sometimes it can make it a bit hard to like read. This he was referred, this were prescribed, he was done. You can use active too. Therefore, I prescribed him painkillers and referred him to a physio. You could have made that sentence active. Okay. No idea what that actually means. Visited my clinic twice with one apart. One apart what? Examiner will have no idea what that is. Are you talking about what? He came with 1 month apart, or he came to see you 1 month later or 1 day later? Well, you've got to be clear. Examiner is not going to write to you and ask you what you mean. If it's not clear, you will be marked accordingly. He is still on pain. On pain? You mean in pain? Those Finsbury sessions were running. Okay, but what's that got to do with anything? Fortunately, the rhythm has improved, especially after increasing dose. Another 1 month sick leave. Another month. So, right, we don't really need 10 minutes. So we don't need both of these. Either another month or 1 month of sick leave was extended. So we don't really need that. Today, Mr. Jones in my clinic asking for, don't need an article. Permission to return back to work was made no difficulty. You could have said something why he wants to go back to work, because it says in the case notes he's like bored, blah, 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 blah. So I would put a little bit there. In light of the above, in view of the above, I would Mr. Jones workplace in order to advise him approach your test perform safely before he is allowed, because he's not gone back yet, so it can't be passed, to return back to his job. Okay. Back. Contact me. Okay. So that's not so bad. Not so bad. Not sure what that is. So there's a few things you've missed out here, but in general, that's not so bad. Not so bad at all. Not as bad as the previous ones. We can see a fair bit of changes there. So I'm going to save these. I'll call this quits for now, because I've got to change to a different platform. I've got somebody coming on Skype and somebody coming on Verbally. So a couple of different sites. So I'll save these files. I'll put them on Easy Class now, and I'll upload this video to the channel. I won't put. I'll put it in. I'll just put it on YouTube, because it's not. I don't think it's a members only thing yet. I think there's a couple of people who aren't in Easy Class here, I think. So I'll just put it on YouTube. So I'll see you later. Possibly tomorrow. If it is, it'll be 9 AM GMT. So I'll be in touch with Joseph and we'll sort something out for then. Okay? Excellent. So I'll see you later. I'm going to stop this now, and I'll catch you later. Okay?